Fantastic. So my name is Jordana Moerbe. I am the Maddie's Medical Program Advisor for American Pets Alive. I am formerly the clinic manager. I started with Austin Pets Alive as a volunteer in 2008. And then I became a staff member in 2009 as a tech, and then managed the medical clinic. And then in 2017, we got a large grant from Maddie's fund to kind of relaunch American Pets Alive as a life-saving academy and teach all of the wonderful things that happen at Austin Pets Alive to the rest of the country, and on shelters all across the country. So that is my current role. But I started at the very, very bottom at Austin Pets Alive. So definitely been through a lot of the changes, and kind of can give a little bit of history if you guys have questions as to maybe why certain things are in place, that sort of thing. This is a picture of Claire. She's my current foster. She was intaked as a distemper dog, but it turns out when I got her about 20 seconds later, I said she doesn't have distemper, but she does have some sort of strange cerebellum issue that we're currently working through. So she's definitely cute as a button, but she has her own little hosts of issues that we're dealing with. But she's amazing, and I have absolutely no doubt that she's going to find a wonderful home pretty soon. So the medical program at Austin Pets Alive really kind of took root in 2009. Again, the organization started in 2008, but it was pretty small. We weren't doing a lot of really hard medical stuff. It was mostly blood testing cats, providing vaccines to the animals that were coming into our care. So it was a lot of preventative work at that point. And then in 2009, we got a trailer that was our medical clinic. And that was when we were able to actually start performing surgeries and really kind of start taking on the injured and ill animals that were still not having a positive outcome at Austin Animal Center. And so the medical program and the foster program together are really the first of its kind in the country for a lot of different reasons. The size, for one, the size of both of the programs is quite large. There's not a lot of other shelters in the country that have the capacity in foster that Austin Pets Alive does, and the size of the medical clinic to be able to support those animals that are in foster homes. The types of medical cases that Austin Pets Alive brings into the program is very unique. As you guys know, and should be very proud of, because you're part of the reason that we're at the save rate is Austin Animal Center has a very high live release rate. And so the animals that are coming into the program are they're either pretty severely sick, pretty severely injured, or they have behavior issues. So the cases that we're asking you guys to take into your homes are much different than they were even 3 years ago. They're a little bit more complicated because, again, that 98% is a higher save rate to achieve, and so that just means a little bit more complicated cases. The operations of both programs are very unique, and again, I kind of keep going back to how they work together because it's pretty unique. The way that both programs function, not a lot of shelters, it's pretty new to the industry. And so there aren't a lot of other shelters that we can look to say, okay, how do we do this? It's something that we have created as we go, and we're still creating as we go, and finding ways to improve it, because there's definitely always room for improvement. And that the foster-centric ism, I guess I would say, of Austin Pets Alive is very unique. The number of animals that we have in foster and the medical clinic that we have to support those animals, again, just really makes not just the medical program, but the foster program very unique. And in terms of the medical program, it is we try to make it customer service based. So we set up appointments for the fosters to come in when they have the ill and injured animals. We have the receptionists up front. And even though it is not a perfect model, it's not a perfect program, I should say, or not program, we have a lot of work to do. There's not any other shelters that really have that model. It's still very much kind of small in terms of the way the fosters come to the shelter. You know, they're texting people, they're calling. And so when we have a larger volume of animals, we really kind of need to shift how we work through issues and how we communicate with our fosters. And so it's to me, it's very much a transaction. There's no money being going between the two, but we, Austin Pets Live, we need you guys to keep fostering, and you guys want to foster. It's why you're here. And so we need to make that fostering process as easy as possible for you so that you continue to foster for us. That's kind of the goal. And so we have this document. You don't have to memorize this and you don't have to read it because it's a lot on here. I'm going to share this document link with you at the end of the presentation. But we do have a document that kind of explains to people how we make medical decisions as a clinic. Because it's such a unique operation, we kind of had to make up a mission statement for the clinic to say, you know, this is what we believe in, this is how we make decisions, so that we can also make them across the board as much as possible, make them, our resources are evenly distributed, is a term I like to use. And so this document kind of helps guide us when we do that. And again, you don't have to worry about reading it or memorizing it, because I'll share it with you. But really at the bottom of this document, the most important sentence really is, we aim to be the average pet owner. You know, we, as Austin Pets Live, we own upwards of 1,000 animals in our care, more than that, probably. And so that is expensive if you let it be. And so what we want to provide all of the animals that are in our care is very, you know, average pet owner of average means. What do those people provide? You know, we want to alleviate pain. We want to repair injuries. We want to treat illnesses, but we need to do that in a way that is financially responsible, so we can provide that same level of care to all of the animals that are in our care. Do you guys have any questions about that so far? Okay. So we have some poop pictures in this. I don't think there's a way to get around this presentation without poop pictures. And I'm not gonna lie, I had my husband look at this and he said, you should warn people there's poop pictures. So we'll go into some poop. So this is a kind of official APA poop chart. And the reason that I'm putting this out here is because the clinic might be asking you, what's the fecal score? What, you know, how runny is the poop? And so this is what we use in the clinic and in the shelter. And so it's really helpful if everyone knows this, so that we're kind of all talking, I hate to use the term apples to apples because it's gross, we're talking about poop, but we're talking about the same type of poop scoring, essentially. And so what we're really focused on is poop score 6 and 7. Those are kind of the two that we would worry about the most, mostly 7, but we'll talk about 6 as well. So if you email the clinic or you call the clinic and they ask you what the fecal score is, this is the chart that they're referring to. So puppies, 6 to 16 weeks old. So puppies and adults have very different care. And we're looking, when we're concerned about maybe some illnesses or some symptoms of illnesses, they're very different in terms of how worried we are about them and if something's an emergency or not. We also have neonates, which is its own separate category. But for the purpose of this presentation, I kept it to puppies 6 weeks and older, and then we'll talk adults here in a minute. So that with puppies, the most important things that we're concerned about is going to be parvo, because parvo is pretty common, especially in this age of puppy. Hypoglycemia, so low blood sugar. Puppies do have to eat pretty frequently, and there's some pretty serious symptoms and things that can happen if a puppy gets hypoglycemic. Internal parasites we're worried about, because those can cause some pretty serious damage. And then distemper, depending on where the puppy came from before it came to Austin Pets Alive. So a lot of, if you call or email the clinic, the first questions that they're asking you are most likely going to be, they're trying to get information about these 4 things so that we know what direction to move in. So puppies 6 to 20 weeks. So these are things that are not an emergency, but you do want to report them to the clinic. So it's maybe something that, shoot us an email, we'll get back to you in the morning or in the afternoon. They can seem urgent if you don't know what they are. They're, you see something in poop and it's like, what is this? You don't know if it's contagious, if it's not contagious. So a couple things that we want you to be looking out for, but not necessarily panicked about, is going to be coughing, sneezing, runny nose with yellow or green nasal discharge. A lot of times what we find is when dogs and puppies, both categories, when they leave the shelter, they may be seemingly healthy when they're in our care. And then we transition them into a foster home. And it almost seems like they kind of go, and then they get sick. So very often we find that dogs and puppies will come down with an upper respiratory infection once they're in the home. And it's also just because they're exposed in the shelter, and so they're incubating it during that time. And then when they get to the foster home is when we see them break with it. So definitely somewhat common. Again, shelters are kind of like daycares for kids. They're not great places for a dog to be, and there are illnesses that they can catch there. Score 6 diarrhea. So if we go back to the poop chart, that's going to be kind of like actually I'll go ahead and just go back. So that's going to be the score 6 right here. So it's not quite watery, but it's definitely not solid. Definitely not normal looking poop. But again, not necessarily extremely urgent. Tapeworms can be super concerning if you don't know what they are for the first time. So it's this bottom picture down here. It looks like little pieces of rice in the poop. It's pretty gross. It's not fun to look at. But the good thing about tapeworm is it's very harmless. It's not contagious to other animals. They do get tapeworms from eating fleas. So it could be an indication that there's, or maybe there was fleas on the dog. So one of the things that you can look for is see if you find any fleas on the puppy. If you're seeing tapeworms, although again, it can be because of a previous flea infestation or a previous, all it takes is one flea. It could have just been one flea. Again, not urgent. It's not contagious to any other animals or people. It's just kind of gross to look at. Roundworms are going to be kind of like spaghetti looking in poop. Again, not super urgent. It can be very alarming when you see it. You look at it and you're like, what is that? But if puppy's eating, drinking, active, everything's looking good, then it's not going to be super urgent, but we definitely want to get those worms treated. Yellow poop can be kind of a concern. If you see your pup has some yellow stuff in its, or the poop itself is kind of yellowy looking, as long as it's not that score 7 really watery diarrhea, let the clinic know. Again, it's not urgent. It's not going to be life-threatening, but it's something that we'll need to know. A puppy that's quiet is a little bit concerning. Puppies, for the most part, are going to be pretty obnoxious most of the time. They should be kind of in your face, wanting to play. They go between playing really hard and napping really hard. But if you have a puppy that's just kind of quiet, it's mellow, but he's alert, he's responding to you, he'll get up and maybe play a little bit. That can be kind of alarming. We want puppies to really kind of just be full of energy and be acting like a healthy puppy should, which is trying to chew on stuff and kind of getting in your face and that sort of thing. So quiet, but alert and responsive. A fever over 103, but under 104. Dogs naturally have a higher temperature than we do. And so 103 is concerning, but it's not an emergency. If it's over 104 degrees, that can be a little bit more concerning. So you'll want to probably call the clinic at that point and get some advice. And all of these things are also dependent on how the dog is acting. If you have a dog that is coughing, sneezing, and has a runny nose, but it's also not really doing anything, it's laying there, it's lethargic, that can be a sign that it's something a little bit more serious going on. So it's kind of putting the pieces of a puzzle together. Are you seeing diarrhea? Maybe that score 6 diarrhea, but the puppy's bouncing off the walls. That's good. We could be seeing a puppy that is quiet, but maybe it does get up and play really rowdy for a little bit, and it's eating and it's drinking. Those are things that maybe just, want to monitor a little bit. So these are not necessarily set in stone. It's putting those pieces of the puzzle together and saying, okay, well, coughing, sneezing, and it's having score 6 diarrhea, and it's quiet, that might be a little bit more concerning. So, more of these symptoms, multiple of these symptoms, is going to elevate the concern a little bit. So then we have urgent and emergency symptoms that you might be seeing in these puppies. So a diarrhea of score 7, if you have a puppy that just has watery diarrhea coming out of its rear end, that's a concern. It may be with blood or without blood. It doesn't really matter at that point. That's a concerning stool score. And we always say bloody diarrhea could be a sign of parvo, but even if it doesn't have blood in it or it doesn't look red tinged, that can still be a sign of parvo. So with or without blood, if you're seeing a score 7, watery diarrhea, that's going to be a more urgent situation. Not eating is very urgent. Even missing one meal, we find that is often actually the first sign of parvo. Not always and not every time, but it is often, and often enough that we say if you have a puppy that's missing a meal or doesn't want to eat, that's a concern. Because again, puppies should be bouncing off the walls. They pretty much always eat, unless they just ate, then they might not go for that treat. But I'll have another tip for you in a second to kind of check a puppy's appetite. But not eating or missing a meal is going to be a somewhat urgent situation. You want to let the clinic know because that's when we're going to be thinking it could be parvo. If they're difficult to rouse or they never play, that's a concern. Again, we want puppies bouncing off the walls, being happy. Vomiting more than once or vomiting once with any of the above symptoms. So if a puppy vomits one time, taking into consideration what just happened, did he just eat a really big meal? Did he just really eat a big meal and then he ran around outside immediately? That could cause an upset stomach. If he's bouncing off the walls and doing everything else normal, it's not necessarily an urgent concern. But if he vomited once and he's also quiet, that's a concern. If he vomited once and he also has score 7 diarrhea, that's a very big concern. So if it's one time, everything else is completely normal, not necessarily super urgent, but if he vomited once and has any of these other symptoms, that kind of raises the urgency of that. Obviously, seizures are going to be a concern. If you notice any sort of seizure activity, you want to let the clinic know right away. And then I kind of separated out small breed dogs and seizures. I'm going to go to this next slide because we have toy breed dogs, especially puppies, that are prone to hypoglycemia, which is just low blood sugar. And so these little tiny toy breed puppies are super, super cute. You have a tiny little Chihuahua that's like under a pound, or a little, maybe it's like a little Maltese mix puppy that's really, really tiny. Those little guys need to eat very often throughout the day, 4 to 6 times a day if they're healthy. If they're sick at all, then you're going to want to make sure you feed them 6 to 8 times a day, and that's including through the night. Because these little guys they cannot regulate their blood sugar, they can't regulate their temperature, and so they really just need that extra, super extra care. These puppies also tend to cut teeth late, and so it makes them needier longer. So whereas a 6-week-old pity puppy, that puppy can eat kibble, that puppy's doing all sorts of things. Whereas a 6-week-old little tiny Chihuahua puppy may still not be eating kibble, may still need to eat wet food. And so a good way to kind of check these little tiny puppies is going to be to weigh them longer. So with neonatal puppies, we have to weigh them to make sure that they're gaining weight, and that's a good indicator of if they're eating well. And with these little toy breeds, it's a very good idea to weigh them longer than you would a large breed puppy. Hypoglycemia will cause seizures, listlessness, they'll be lethargic. And they'll also just be uncoordinated. You know, they're going to be walking kind of wobbly. They're going to be off kilter, just like people when they become hypoglycemic. And so if you're fostering a little tiny toy breed, make sure that you're feeding it often throughout the day. And if it's sick, you'll need to give it a little bit of extra attention. And then these little toy breed puppies also need that warmth. And again, this is something they need, just longer of that neonatal care. Again, you know, a 6-week-old Chihuahua puppy is not going to be able to regulate its body temperature as well as a 10-pound shepherd puppy or lab puppy, something like that. Any questions? Okay. So this meatball test. So this is something that we do in the shelter that is a really good indicator of, is this puppy not eating because it's sick, or is it not eating because there's something going on that we need to address? Or is it just full? Does it just have a full belly? And so what we do is take a meatball of canned food. I have found that human food doesn't work as well. But if you take just a meatball size of like pedigree puppy, something maybe kind of junky that they love, a healthy puppy will, for the most part, always eat it. They're always going to just go for that little meatball of food and gobble it up. If a puppy doesn't gobble up that little ball of food, something might be wrong. You could actually email the clinic and say, I tried to do a meatball test and it didn't take it. They'll know exactly what you're talking about. So it's a really good indicator. Even a scared dog, if you're fostering like a, you know, a real shy, scaredy puppy, maybe it's like a, you know, feralish puppy that came in off the street. If you give it some privacy and just kind of leave the room for a few minutes, that puppy will come out, a healthy puppy will come out and eat that meatball. So it's a really easy test. It's cost effective. It doesn't take a lot of time to find out if the puppy's not eating because it's just not hungry, or is it not eating because it's stuffed. But something about that little meatball that they'll just eat if they're healthy. So adult dogs. So adult dogs are a little bit, they're not necessarily trickier, but you know, with puppies, we're kind of looking for certain things. We're worried about parvo, we're worried about intestinal parasites. Adult dogs, when they're moving into foster homes, you know, they're healthy. They're, for the most part, healthy. There could be a lot of things going on with them, and they do a lot of different things for a lot of different reasons. So it can be a little bit trickier, but it's usually less urgent with these guys. So something that for adult dogs, and there's a gap in the weeks if you notice that. In the puppies, I put 6 to 16 weeks, and here I started at 20 weeks. Because there's that period where they're like teenagers where they kind of fit into both categories. But with an adult dog, they might not eat once they come into your home. If you just started fostering an adult dog, and this is typically dogs that are a few years old, we don't give them enough credit as far as stress goes. And so they just may not eat. And if they're doing everything else normal, if they're playing, they're running around, they're curious, their poop is normal, it's not necessarily a concern. You'll want to report it to the clinic just so it can get on their radar and they can maybe give you some advice. But it's very possible that some adult dogs just don't eat when they get into homes because they're stressed out. They don't know what's going on. And so they just kind of are shut down a little bit. My own dog didn't eat for 5 days when I brought him home. And everything else was normal. And so I didn't really worry about it too much. And sure enough, he came around. Typically, they don't go 5 days. Typically, they'll start eating on day 2 or 3 if there's food striking against you. Or sometimes they're just picky. A lot of adult dogs, if they're coming to your home, they're stressed out, but they'll definitely go for that kind of more junky dog food. And again, that's kind of only if everything else is normal. If they're not eating and they're also having score 7 diarrhea, if they're not eating and they're also very lethargic, if they're not eating and they're having nasal discharge or coughing or sneezing, then again, coupled symptoms, more than one, are going to elevate that concern a little bit. Diarrhea score 6 or 7, not a huge concern, whereas in puppies, score 7 diarrhea was an emergency. In an adult dog, if everything else is normal, he's eating, he's playing, he's active, not necessarily a huge concern. It needs to be reported and it needs to get addressed, but it's not going to be something that you need to call the clinic for at 3 in the morning. But it definitely needs to be addressed as soon as we can during working hours. Coughing, sneezing, nasal discharge is kind of like in the puppies. Tapeworms again, and then adult dogs can also have the roundworms, which is the spaghetti worms, more common in puppies, but adult dogs can definitely have them. And then again, that fever over 103 but under 104 is going to be something that needs to get addressed, but not an emergency. Urgent and emergencies. So this list is not comprehensive. I could go on with this for a very long time. But this is something that we have identified that yes, we need to address this urgently. Excessive bleeding, if they've cut themselves on something and it won't stop bleeding, that's a concern. If they can't get up, struggling to breathe, if they ingested something poisonous, moderate to major trauma happened, any seizures, rapidly worsening known medical issues. So if you had a dog that, you know, yesterday was coughing and sneezing, maybe you picked up an antibiotic from the clinic, and then today he can't get up and is struggling to breathe, that's going to be urgent. Excessive pain, and dogs can be pretty good about hiding pain, but if they're screaming out in pain, they're not letting you touch them, then that's going to be urgent. And then a fever over 104. And for that fever over 104, it's possible that you'll call the clinic and they'll say, okay, we need to address this in the morning, just depending on, you know, the history of the dog and the background, but definitely something that the clinic should know about. And of course, a lot of these are going to fall into puppy categories also. For me, this is a kind of worms because I could talk about this for a really long time. So a lot of these obviously fall into every category of urgent and emergency, but for adult dogs, this is kind of the most common that we see. Any questions about bringing new dogs or puppies home? Okay, so we're going to kind of switch gears and talk about mobility issues. And this is something that you can either, if you have considered fostering a dog with mobility issues, it sounds really complicated and it sounds really difficult. You know, can I provide that care? I don't know if I can pick them up to take them to go outside. But there's some tips and tricks that you can do. It's not quite as scary as it sounds necessarily. So hopefully we can kind of answer some of your questions. And I'm going to call Pam out because Pam has fostered many dogs with mobility issues, definitely more than I have. So she's just as much an expert in this as I am. And some of the mobility issues that we're going to see are going to be post-orthopedic surgery. So if you're fostering a dog that just went through knee surgery, hip surgery, those are the two most common ones, then they might fall under this category. Broken pelvis, we actually get those quite often. Dogs that were hit by car, they end up with a broken pelvis. There's really no treatment for that other than some time. And then we have the other kind of undiagnosed. You know, we don't know why they can't get up. They're probably the vets are working through their case and we're trying to determine why it is that they can't get up. And then some of these guys are going to be plus or minus some incontinence issues. And it might be urinary incontinence and fecal incontinence. So orthopedic surgeries, the main thing with these guys is really they just let them set their own pace. Dogs are pretty good about, most dogs anyways, are pretty good about limiting themselves, especially after an event like this. Again, some dogs are going to try to just sprint out the door no matter what. But the majority of dogs are going to limit themselves and they know what they can do and what they can't do. That being said, anytime you walk these guys, you're going to want to make sure they're on a leash. You know, don't just let them have total free reign of the yard. So you can control how fast they're moving. We don't want them to go from 0 to 100 in 1 second. We want them to go very slowly. They can bear some weight on the limb that they had surgery on. If they had knee surgery or hip surgery, it's okay if they bear some weight, again, as long as it's kind of at their own pace. Some toe touching is pretty normal after surgery. I have seen dogs with hip surgery that just walk out like nothing happened. Again, if that dog feels like that's right for him or her, then that's usually okay. Make sure that they keep their e-collar on. Most of these guys are going to come out of surgery with a bandage, especially the ones that are having knee surgery. They'll have a wrap kind of like this dog that's laying on the sofa. And so you want to make sure that they're wearing that e-collar so that they can't then turn around and chew at that leg wrap, and then potentially chew at the incision, which would be not a good complication. So make sure they're wearing their e-collar, and then really just following the post-op instructions that the orthopedic specialist gives us. He has it detailed out pretty well. And so as long as we're kind of following those guidelines, you'll be okay. But again, letting them set their own pace. If a dog feels like they are able to get up and slowly walk to the door, even if it's the same day of surgery, that's okay. Some dogs are gonna say, nope, I can't bear any weight on this limb for the next 3 days. And so we can help them by kind of using those towel slings like you see in the picture below. Even using something like a towel or a blanket to just help support them goes a really long way with these guys, and it's pretty easy to do. For the broken pelvis or dogs that can't get up, so these are dogs that can't get up and really shouldn't get up. We don't really want to push them at all. Generally, we want to keep them crate rested. In a crate, we'll do like the black wire pop-up kennels so that they can't actually get up and move around, because we just need them to sit in place and heal. Using pee pads are going to be your best friend. They're not super cheap, but I have found, I posted a while back about, fostering a dog and they need pee pads, and a bunch of fosters offered to kind of help, which is really nice. They do sell washable pee pads now, which is pretty cool. So you can just rewash them. But these are dogs that, yes, we want to keep them contained. We don't want them getting up necessarily. There is some part of this, though, that is kind of letting them go at their own pace. So if we get a dog and it's day 3 of it being in our care, then we want to pretty much keep that dog from being able to get up. If it's on week 6 of crate rest and that dog feels like it can stand and walk some, then that's okay. It's towards the end of that crate rest period. Its fractures are probably a little bit more stable at that point. We still want to make sure that they're always on a leash. We're supporting them if we need to. But again, letting them go at their own pace is going to be important. If we have a dog that can't get up, you do want to rotate its sides because they will get bed sores just like people. And so every 6 hours is appropriate. A little longer is okay if you have to work. We want to make sure that people don't feel like they have to, constantly be in front of these dogs helping them, because that makes it impossible to foster them. And so, 6 hours, 8 hours, while you're home, if you're going every 8 hours, rotating them, the time that you are at home, maybe in the evening, doing it a little bit more often will be helpful. You can kind of do some physical therapy with their legs. And when we say physical therapy, we don't mean like pay a physical therapist to come do it. It's really just range of motion, getting their legs and kind of moving them in the motion that they normally would is helpful to them. Making sure that there's not too much muscle wasting happen. But again, it's really basic stuff. We're not talking about anything complicated. We're really just kind of stretching their legs out a little bit. Giving them some outside time is good. I always find that these dogs that can't get up, they spend the majority of their time inside. And so giving them that outside time just in the grass really kind of lifts their spirits. So if you can do that, I would definitely recommend it. And again, girding them with a blanket or towel. If they can support their front half of their body, and we can just completely support the back half, whether that's going to be under them or gurney style, that will help them. I typically tend to just gurney all of them outside. So you can, depending on the size of the dog, you can sometimes do it yourself by just grabbing all four ends of the blanket or the towel in both hands. I have also had to drag a dog to give him some outside time. So just getting him on a really big blanket and just kind of placing them strategically in your home, kind of by a door or something, so that you can actually kind of pull them outside, or you can put a piece of cardboard underneath the blanket so that as you're dragging them outside, it makes it a little bit smoother to get them from point A to point B. And again, by the time they get up, it's probably going to be okay. We just want to make sure that they start slow and that we support them if they need it. And just make sure you keep them on that leash so they can't just get up and tear out, because some dogs will do that. Pam, do you have anything you want to add? I'm going to kind of put you on the spot. And while Pam's trying to unmute herself, I'll just add Pam has been a foster for Austin Pets Alive for, I don't know, since 2009 or 2010. And her specialty is our broken dogs. Lots of distemper, but she also does a lot of physically impaired dogs. So she can speak to this very, very well.
Okay, I am on now. Yeah, I think you covered that beautifully. But I was just thinking of, you know, the pups that I have that can't move for another reason other than broken pelvis. And if they have problems with losing muscle wasting and they can't move, I found it very advantageous to have them on a wedge. I use a memory foam wedge where their head is up higher, so that when they're swallowing or they're eating or whatever, it's going down.
Awesome.
Well, yeah. Instead of staying horizontal.
Yeah, that's great.
Yeah, that's been really helpful for me.
Awesome. That's great advice.
Yeah.
Thanks, Pam.
Mm-hmm.
And then the last slide I have here is incontinence issues that may or may not be present with some of these mobility issues. If it's a dog that is requiring bladder expression, the medical staff will show you how to do this. If you get home and you can't express the bladder, it's not necessarily an emergency right then and there. If you go maybe the next morning, let's say you took the dog home in the evening, that night you couldn't express its bladder, you just, you know, couldn't feel it. And then in the morning, you again weren't able to express its bladder, that's when it might be more of an urgent issue, and you want to call the clinic right away so that we can get, we'll probably have you bring the dog in so that we can express its bladder. If you get the dog home in the evening and you aren't able to express its bladder that night, but then you can get it in the morning, great, that's perfect. So kind of that consecutive time that you can't express the bladder is going to be more of an urgent issue, because what happens is the bladder just ends up getting bigger, and then it can cause UTI issues, and then you're going to have what is overflow. So it might look like the bladder, like the urine is actually coming out on its own, and you don't need to express it, right? It's like, great, I have a bunch of urine on the pee pad. He must be going on his own. When a lot of times that is actually just overflow, and the bladder is so full it's just coming out. And so you definitely want to make sure that you're always checking the bladder and expressing it to the fullest every time you go to do that. And that's going to be 2 to 3 times a day. I'd say probably closer to 3 times a day. But yes, if you're seeing that overflow, it looks like the dog's peeing, you still want to make sure you're emptying that bladder, because chances are that the bladder is not emptying on its own. And again, pee pads going to be your best friend. If it's a small dog, you can do it, you know, over the toilet or outside, even if you're able to get them outside. And then that's kind of just less mess for you to clean inside. For fecal incontinence, you can actually,
Jordana, can I interrupt you?
Absolutely.
This is Lynette. I apologize, but I don't know what expressing is. I mean, I can understand that means probably some kind of pressure to But how do you do this?
Yes, yes. So yes, that's exactly what it is. So it's actually just squeezing the bladder from the outside, and to empty the bladder. And so if you take on one of these dogs, again, the clinic will show you, but the bladder feels like a water balloon. And that's kind of what we're looking for when we're looking for the bladder from the outside of the body. And then once you find that water balloon, it's gently applying pressure so that you can expel the urine. It sounds very difficult. And it's really not difficult. Some dogs are easier than others. Usually dogs are not difficult. Cats tend to be a little bit more difficult. But with dogs, it's usually just squeezing the urine out, and they don't give you any sort of fight, or it's not complicated. They just kind of are like, okay, thanks. But yes, that is exactly what that means, Lynette. It's just getting the bladder to empty by applying pressure from the outside.
And do you apply pressure only like from the sides of the abdomen, or do you apply it from the back and the abdomen together? Does that make sense?
So you can do it either, Pam's motioning. You can kind of do it two ways. So you can do it from the sides. You can do it, let's say the dog's between my hands. You can apply pressure from the sides, from both sides evenly. You can also apply pressure from the, underneath the dog, and kind of squeeze their belly, not really their belly, squeeze their, where you could imagine the bladder would be.
The bladder, okay.
Yeah.
Very good, thank you.
Yeah, you're welcome. And so fecal incontinence is, again, it can be messy, but it doesn't always have to be. It's something that can be controlled and doesn't have to sound as bad as, or doesn't have to be as bad as it sounds. You can actually kind of help massage it, kind of how you would express a bladder, to help empty the bowel so that the dog isn't pooping small poops often. And again, that's something that the clinic can help you do, so that the dog is actually pooping a full poop, and then you don't have to worry about it for another, 8 to 12 hours, however often they poop. So that's one way to kind of just ensure that it's not something that you're having to go back to and just pick up poop all the time. Solid stool is the goal. So if you're fostering one of these dogs, you want to find the food that works for them to keep their poop solid. You want to minimize treats, minimize any sort of junk food. The clinic doesn't have the ability to do a lot of like prescription type foods, but something low fiber is going to be helpful. And really just the key is, what food is it that dog can eat that's not going to cause diarrhea? And that can be different for all dogs. What causes diarrhea in one dog doesn't cause diarrhea in another dog. So just finding what food it is that works for them. Because again, if solid stool is going to be much easier to manage than a dog that's having diarrhea and is also fecally incontinent. And again, pee pads, kind of just keeping those pee pads underneath them, so that if you just need to swap out a pee pad, if they have, an accident during the day, change out that pee pad, no problem. Diapers, they actually have doggy diapers. And it seems like the clinic always has a lot of these. They get donated very often, but you can actually get diapers and a diaper cover to keep on a dog, which makes it pretty easy to manage as well.
They have some in the foster shed.
Yes.
Yes.
Yeah, and that's something that, if it's a supply like that that's needed, APA can probably find you that supply to make your life as easy as possible. Any questions about that? That is the end of the presentation, but I'm here for questions.
Good presentation.
Thank you. And fostering always seems, it's kind of stair-stepping. I stair-stepped into complicated cases, even as a tech, knowing everything that goes into fostering. And again, there are also things that I love to foster that somebody else doesn't want to foster. So you kind of, find a niche in medical fostering where it's like, you know what, this is the kind of care that I really enjoy providing for a dog. And some things might not be. For example, I was fully ready to take on this distemper dog as a foster. And then when I found out she didn't have distemper, she was actually quite healthy. I don't know what to do with a healthy dog. And she's not totally healthy. She does have some brain stuff going on, but it wasn't what I thought. And I'm more comfortable fostering sick animals. And whether it looks like a parvo dog, a post-parvo dog, a mobility dog, a fecal incontinent dog, or a urinary incontinent, I feel like there is something for everyone out there. And it's just kind of finding what you're comfortable managing, and what gives you the fulfillment to foster dogs like that. I feel like Pam's found her niche.
Yeah, I have. I love all the medical. Yeah.
Yeah, and it really is less scary. It's asking a lot, so I'm going to stop sharing. It seems really daunting, when you see these foster pleas and it's, a dog that can't get up, or a urinary incontinent dog, or a distemper watch dog. But the staff and the volunteers are here to answer questions that you might have, and we have so much support that hopefully, if you are willing to kind of take that chance and foster a dog that you maybe aren't super confident or aren't super sure that you can do what you need to do, we can get you that rest of the way. We can help you get to that 15% and help you feel as confident as possible.
Yeah, I think so too. I think so too.
All right. Well, thank you guys.
Yeah,
I will pass
you
it
so
back
much.
over to Kelly. Yeah.
Okay. Yes. Thank you guys. We really appreciate your coming. I will post a link to the recording probably tomorrow, so you guys can share it or and stuff. So thank you so much, Jordana. That was really
Yeah.
great.
Yeah, you're welcome. Thank you, everybody, for fostering. You guys are lifesavers, literally. So thank you.